Welcome back from the break. Now, if you're a health worker in Ghana and thinking of seeking greener pastures in the UK, you may need to have a rethink because the UK government says the UK social and health employers must not consider health workers from Ghana when they are employing health and social workers. Now, the announcement was made by the UK government in its revised code of practice for international recruitment of health and social care personnel in England. Now, the code states that some developing countries such as Ghana, Cote d'Ivoire, and Nigeria are among a list of 54 countries that should not be actively targeted for recruitment by health and social care employers in the country. So that is the news coming in from the UK. We're joined on the phone, on the lines by the General Secretary of the Ghana Registered Nurses and Midwives Association, David Tinkran. Grateful, sir, for joining us here. Now, in December 2022, in an interview you granted, you said that averagely between 400 to 500 health workers leave Ghana. They settle for the UK, Ireland, Wales, Canada, and the US of A. Now, you said, quote, if we don't put in place measures to keep them in Ghana, we can lose all of them, and that's a problem for us, end quote. Now, how is the Ghana Registered Nurses and Midwives Association receiving this news from the UK that don't engage health professionals from Ghana?
All right. Good evening to you and your viewers. I think this directive is much ado about nothing. The UK government has just penned down what is currently going on. It does not exclude individuals who decide to apply to a health facility in UK. What they are seeking to emphasize is, for instance, mass recruitment by recruiting agencies. And the practice that we have is that individuals are applying to various health facilities in the United Kingdom and getting employment. And mind you, there are several destinations. Okay, UK is just one of them. Nurses and midwives, that matter, healthcare workers are traveling to several destinations in the world, not only UK.
No, but is it not the case that they were able to migrate there prior to the release of this particular, note that don't employ people from Ghana? And that from today, that may be the case that they won't allow people, health workers from Ghana entering UK to work.
Yeah, so what I'm saying is that the system of recruitment is different, okay? They have various means of recruiting health workers in UK. You, as an individual, can apply to a health institution and you'll be taken on board. And it's ongoing and it will continue because migration is a right. There is no way they can stop anybody from coming to United Kingdom to come and work, so long as you have the requisite qualification.
So what do you expect the UK government to do then, to put an end to this, where health workers migrate from Ghana to work in the UK?
What I'm saying is it's just politics. They can never stop it. Look, by close of 2020, UK had lost about 40,000 healthcare workers. How are they going to replace that? So the recruitment process will go on. The WHO has a guideline on ethical recruitment, and that is what they are seeking to emphasize. But it does not preclude them from continuing to employ our people. For instance, the Ministry of Health has an ongoing conversation to sign a bilateral agreement with the UK government to export nurses to United Kingdom. That, I'm told, has not been put on hold. But don't let anybody delude himself into thinking that if UK is stopping nurses and midwives from coming to their country, then it means that the attrition has stopped. No. There are various destinations. Austria has opened up, Germany has opened up. And what government must do is to be very intentional about putting in measures that will retain our people. We don't need to train and lose them. Okay. The good people of this country also deserve quality healthcare, and we need to retain our people.
David Tinkran, I'm grateful to you for joining us here on JoyNews. He is the secretary to the Ghana Registered Nurses and Midwives Association. Now, still